Hi, I'm Penelope Arthur. I'm at Quilpie today attending a meeting with the mayors from the South West Queensland Local Government Association. Rural health has emerged as a major issue here today, with news that the Morven Health Service could be closing down. There's a lot of anger amongst the mayors here today, directed at the South West Queensland Hospital and Health Board, who were invited to attend today's meeting but declined. I caught up with some of the mayors to discuss the health issues facing their shires.
The issues for our shire is with Morven. I went to a video conference with the hospital board on Monday, and they told me then that they were going to enhance Morven's hospital situation, and I was quite happy with that. But then I got an email today saying that the position has already gone and the meeting's on Monday. And I just believe they've put the cart before the horse here. I mean, it sounds like they've already decided, and the people are going to go to a meeting. It's the people that should be deciding what happens in Morven. You've got to have some sort of clinical centre in Morven.
Well, no, most certainly not. We've been off to a very bad start, so I guess things can only get better because they can't really get worse. You know, we've had very bad experience with them earlier on when they first were formed, withdrew doctors out of the Bollen Bush Nursing Centre without notice and left patients sitting in the waiting room waiting. So we have had discussions with the board since, and certainly reached a much greater level of understanding with them. But I believe that the role of the health board is to reflect the needs of the community, and they've been extremely reluctant to consult with the community. So I'm in a quandary as to how they're actually forming their views.
Well, number one, we can't seem to get them to come to our local government conference. We've sent the invitation to the chairperson plus the CEO, and they don't want to turn up. There's a lot of issues we'd like to discuss, not only us but the other mayors and other councils, about all these people being put off lately. We believe we're losing one position of a nurse. We haven't been notified yet, but everybody seems to be telling us that. So we'd like them to come here and to find out what's going on.
Well, we haven't met with the board as such yet. We've met with Julia Lees and the CEO, but we're very concerned about the future of our doctors in Cunnamulla. At the moment we have locums who work on a roster. We have 9 very, very qualified doctors, but they're a very expensive method of delivery, we understand that, but to date we haven't been able to achieve any certainty in what we're going to get into the new year, except that the regional hospital board, the regional medical board have said that they're going to discontinue locums, so we're very concerned about the future of health services.
We haven't got to know them yet, but we do have the CEO coming to our meeting in Rome next week. And certainly I'm disappointed they haven't showed here at Quilpie to address the mayors and CEOs in attendance and just to give us their thoughts on where they're going and what their directives are from the government, how they're going to approach things in the next 12 months. Would have been nice to hear that, but I guess we'll hear it as individual councils over the next few weeks.
Penelope, it's probably too early to say yet about how we sort of rate the board. You know, they're still finding their feet, and we're only just hearing whispers about possible cuts out here, so that's obviously our biggest issue. Any cuts to frontline services is something we have a problem with. We have been sort of assured that that won't happen, so we'll take them on face value there.